All right.
Yeah.
It's the bottom of the ninth. Angels need to strike out right here to win the World Series against the Dodgers. Here comes the first strike.
You got this, bro. Blow it up. I'll shoot you straight. Hurry up and hurt your arm.
Ah!
Oh, shoot.
Coach.
No one's on that one.
What happened?
I don't know, I think I heard something pop right here on that last pitch. Oh, no, that hurts. Oh, okay, yeah.
Yep. Your rotator cuff tear.
It's gone, dude.
You're out.
That bedside
All right, you guys, so we're going to focus on the rotator cuff tear today. We're just wanting to mix it up and go with upper body for you. This is a really common injury. You're going to see it in baseball, volleyball, water polo a lot. A reason for this is that like the accelerator muscles are trained really commonly, and then the decelerator ones really aren't. So that's why you see a lot like with the drive line for baseball recently. A lot of like the reverse throws that guys are starting to do, and working on like heavy ball stuff like on the trampoline, a lot of that stuff. They're doing it to like try and get those muscles involved that aren't really involved in the throwing motion. This leads to the wear and tear, and that's where you're going to see injuries like this, specifically in baseball. So yeah, we're going to talk about what we're going to do today.
Yeah, so before we all get started, we're going to have you guys line up in 3 rows facing me. So you guys can split up. Just split yourself evenly, 3 rows facing me. We're going to do a little warm up here, get our shoulders nice and loose.
Yeah.
I'll go back.
Just 3 rows.
See you guys get out here.
Yes, it's spread apart. And then you can go down a little bit more.
All right,
So I'll be shift over.
we're going to spend the first couple minutes just warming up our shoulder. So we're going to do 10 sets of everything. So we're going to start off with just doing some arm circles forward. So I'm nice and small. Just keep them small.
Some air in here.
8, 9, 10. Now reverse it.
Yeah.
Backwards. Make sure we keep them upright and small. All right, from here we're going to go 10 touchdowns. Sweeping up to the sky and pulling down. 3 more. All right, now with the arms out in front, we're just going to try to scapulate and bring our shoulders back and then forward for 10 of these. Kind of reaching forward with the shoulders, just pinching them back. 3 more. All right, now the arms at 90 degrees. We're going to start here and just bring them down and back up. Make sure to keep our elbows at that 90 degrees. 3, 2, 1. All right, shoulders start to burn a little bit. Reach them out like this and down, just twisting at the wrist.
That's a clinical term. Yeah.
3 more. 2, 1. All right, 2 more. Finish up with just doing some Ys. Quick, keeping our thumbs up. Keeping our elbows in that Y formation. Making sure we're keeping our chest back. 3 more. All right, last one here. Now just bring them straight up and down.
Right in front of you.
3 more. All right, you guys can shake them out, let them loose. We'll take our right arm across, reach it forward. Shake that arm out, the other one. All right, you guys feel pretty warmed up in the shoulders?
Oh, yeah.
All right, sweet. So for our first milestone today, we're just going to break you guys off into 2 big groups. We're going to be going over some external and internal rotation. So me and Crystal will be over here. We're doing band work, and like I said, external, internal rotation. And then Yazi and Dean will be focusing more on some band extensions, and Yazi will be doing some wall angels. For this first milestone, it's going to take place right after surgery. It's like the first couple of weeks after surgery happens. That's called the phase 1, and that's the maximum protection. So it's really important that we're making sure we're getting that range of motion back and making sure those ligaments get strong in order to keep that shoulder joint secure and good. So I'll bring you guys off in just 2. We're going to count 1, 2, 2, 1, 2, 1, 2, 1, 2, 1, 2, 1, 2, 1, 2. All right. All the 1s will come over here with me and Crystal, and all the 2s will go over with me and Jan.
This is the only time I haven't been.
All right. Yeah. Just gonna do what we have. 8, yeah, perfect. So you guys want to speak up in these 4 and 4. 4 you guys will be with Crystal, 4 you guys will be with me. Before we break off, like I said earlier, we're going to be working on some of that external, internal rotation, getting those muscles nice and loose. And then with the band, we'll be also working on strengthening those ligaments, those decelerated muscles like we talked about. So, you guys, Crystal, you can go ahead with them. And I'll take you guys over here with the bands. All right. So like I said before, just strengthening up those decelerated muscles. So what we want to do is get out to where it's a little good tension on here. And then we're going to bring our arm all the way across right here and out to 90 degrees. You want to make sure you don't get past 90 degrees, so that's putting more tension on here. And you want to make sure you don't go too little, else you're not getting that full range of motion for that shoulder. So we're starting here, making sure we stand up nice and straight, gaze forward, slowly out to that 90 degrees, and controlled back. You want to make sure it's nice and controlled, but not just flying through these like this, because that kind of defeats the purpose. Just nice here and back. So we'll do a set of 8 with those, and then from there, we're going to bring it up. Make sure we get that 90 degrees here with the elbow again, and making sure this one stays flat. And right here, a lot of times people will start to get their arms down, and that's not what you want. You don't want to get them too high. You want them just about shoulder width, and we're just pulling that down. Does that make sense? All right, so you guys want to choose your arm. If you're right-handed, it's going to be your right one. If you're left-handed, so we'll split up. So 2 people go on this one, and then 2 people on this one. If you guys have any questions, you guys again, we're just starting off at our waist here.
It's not important.
You guys want to go ahead and give it a shot?
Everything is to avoid.
Got to take this, Jack.
When you're doing these exercises, depending on the severity, the goals are different.
Are we holding? Yep, exactly. Yep, perfect. Which ways are comfortable? The holding's not too important. We're really just trying to feel that rotation through the shoulder. Nice, yeah. Perfect, yep. Just feel the rotation of the shoulders.
Yeah, well, like, no, but to control it going back. I mean, like, it depends on the straight stepping, but like.
Might be more comfortable.
How's that feel, Nick?
Yeah.
Perfect, you're doing good. Yeah, once you guys finish, we're going to set an 8 of both. Go ahead and pass that to your partners.
Too much. You don't want to be injured.
2 seconds. 30 seconds.
Same side?
Again, it's going to be about knowing who you're patient.
Perfect, yep.
Somebody who is really active.
Exactly, just trying to feel that rotation from that shoulder. You don't want to try to get it from the elbow, just more focus on
Are going to want to be aggressive.
Yeah, it's weird because it's like not that hard to pull forward,
Exactly.
but then you're trying to control it back, and it's like, wait, no, I don't want to just get pulled back over there.
Perfect, that looks great. How's it feeling, Leo? Nice. Looking good.
So when you guys are talking about like the accelerating is the decelerating.
That's actually for the ball, yeah. MSD is like usually digitally accelerating the arm. It's kind of that tension up.
So that's when it's
Yeah, that's when it's
Alright, rest, make sure last set.
because there's less tension on it.
yeah, it does slow down all that tension. It's pretty common. Get it to stop real quick. Rotator cuffs, yeah.
Are we going again?
Chris, how you doing over there? Good? Alright, so once we finish with the last set, we'll just do a quick little switch right here. That's what you guys do.
He's somebody who feels like.
Alright, Tommy? Tommy? Alright, we're going to do a little rotation within our group. So Josh's group will go to Dean's, Dean's will go to Yach's, and Crystal's group over here will come to mine, and mine will go to Crystal's. So it's a
Alright, so we're going rotation. combination.
Like I said earlier,
So
we're gonna be
for
working
this
on
exercise, we're gonna start with the basic stretch that we all know.
shoulder. So for this jam work,
Alright, but we're gonna add
make sure you get a little tension on the rope, stand out.
wooden stick.
We're gonna start with our hands on the waist.
So you're gonna grab your injured hand and you're gonna grab it behind your back and then grab the non-injured hand on top and then start to pull. Make sure it's slow and controlled because in this phase, your rotator cuff is high here, so you have to take your time with it and then you guys can stop pulling once you feel like
So
your
set at
tension
8 right here.
stretched in your
Nice and controlled. And once you finish this, about shoulder height.
get the smart.
And again, make sure it's slow and controlled down. Oh, this is nice. Do this at 8 though, just make sure don't get too high. It's not too overhead that shoulder. Nice. So you guys just put up all groups. Switch out. You guys can go ahead and
Exactly.
just perform the arm.
So are we doing just like the last stretch, or are we
Right back here. First one right here, yeah.
Alright, where am I supposed to
Just want to make sure you keep that elbow in too. It is Am I right?
Yeah, you're
Is it the front or the back?
yeah, it should be the
So again, we're just gonna use
yeah, like this and
And then when you get up, make sure you stick on that shoulder.
make sure your arms kind of like this.
what?
On that shoulder.
It's a little bit better because that's nice.
Looks like you get it.
And then bring your shoulder back. You feel it?
Yeah.
Front? Oh, you do? What'd you do different?
I switched out.
Oh, you switched up.
Okay, and then we're gonna rest and then do 2 more sets of 30 seconds.
Like a head on.
How's it feel?
So good.
And the left hand.
Start it. Next 30 seconds.
Oh, yeah. Looking good.
1, 2, 3.
Yeah, it's feeling good. Feeling a good stretch there.
Yes, so once you finish that one, just make sure it's the shoulder height.
It was the choice I gave that was like, always like dropped it. So we made a shirt.
It's a sweet shirt. It's a combination.
What is it?
Such
You guys look good.
Wait.
And then we're gonna rest and then do our last 30 seconds.
It would be nice. He just dropped them halfway.
Oh, it's by the way, super casual. So, all right, Tommy.
John!
Tommy.
John!
All right, now we're gonna do full rotation. So for this group over here, we'll go you guys over here.
Just feels good.
Alright, so 4, Henry, or 5. Or Leo, come with us. Come with us. Just kidding.
We'll get you next time. Alright, sick. Alright, guys.
So again, we're emphasizing we're post-op, so like rotator cuff injury. So we want to get those range of motion back with our shoulder. So what we're going to be doing is we're doing what's called wall angels. So pretty much you're going to be doing is we're going to be not at 90, but you're going to be slanted over to like 30 degrees. And you want to have full body contact with the mirrors, turns touching, your back's touching. It's not arching here, so keeping this core tight is important. And again, we want to keep this at 90. And what we're going to do is simply just come up, come down. And again, we don't want to lose contact, so we don't want that elbow coming out, or vice versa, the hand coming out like this. Everything's touching the mirror. Our head facing front. And we want to keep this good tempo of coming up 3 seconds and coming down 3 seconds. So 1, 2, 3, fully extend. 1, 2, 3, coming down. 1, 2, 3, 1, 2.
Are you making like a W at the bottom or like 90 degrees?
Just like a 90 degree. Okay. 1, 2, 3. So you don't want to come all the way down here.
Okay.
Because then that's when you're just keep it 90 here. Let's give it a try. Make sure you're squeezing those muscles when you come down and fully extending those elbows when you come up. Let's get together, give each other space. A little slight little bend. And we're going to start at 90 right here. Perfect.
Patient who has a very significant AC
Everything, contact wrist as well. And perfect. There we go.
charging the neck,
Hands
returning a drop
up.
shot.
Yeah, let's go. Up. 1,
As he returned the
2,
shot,
3.
he realized that his head was going to run into the post, so he returns it, turns his head to the side as the post just comes in and crushes his shoulder.
Kind of come to the middle a little bit, or just straight up?
So for him, he's a really active person, so he wants to be aggressive with his rehab program as well. His AC joint separation was pretty severe, so
Make sure you get this bend right here.
goals that were not really focused on the range of motion quite yet. It was avoiding pain at all costs. So while he's going through his rehab program, he's somebody who had a pretty active lifestyle, so was being forced to kind of pump the brakes and really just go through.
Let's do 3 more. 1, 2, 3. Does anyone have any injuries in the shoulder that can't do this? Good?
Real injuries.
Alright, let's take a little break. How's that? Yeah?
What their
Good?
goals are. So if you have somebody who
So let's make this a little bit harder.
maybe some strength,
So we won't do as much,
then you
but
can be more aggressive. You can increase
we'll
the
progress it. So again, a little squat. Again, shoulders are back. And keeping this 90 degree right here, coming straight up and then coming straight down. But this time, we're going to have our right hand up the whole time, and only our left side is going to be working.
some common mistakes
give it a try.
that you see when people are
So
doing this.
everyone have
They
right
let
hand
their
up.
elbows get far off their body.
Good squat position, perfect. Extend all the way up, all the way up.
Bring it
Good.
up
Right
and get
above
this
us.
trap
Right
involvement,
here.
and that's not really the goal with this specific exercise.
Perfect.
You
And
just
then
keep
our
your
left
left
hand is going to be
and
right
slow, like you're almost an external rotation there.
Yeah, and then our left hand's gonna get yours. Ready, set, go. Up, 1, 2, 3, full extend all the way. Match your other hand. 1, 2, 3, come down. Up,
And pull aparts,
1,
not the most
2,
exciting
3,
exercise ever,
down.
but there
1,
is an
2,
important level of
up,
analysis that
1,
you need to
2, 3. Remember to keep that core tight. 2 more. 1, 2, 3. Last one coming up. 1, 2, 3. Come down for the last one.
too aggressively.
Good. Now switch.
All right, Tommy?
Up.
Tommy? John? All right, switch between groups now. Guys, you go to down.
These guys is working me.
Alright guys, how we doing? Our next system.
Alright, so as you guys have been going around and been doing a lot of band and stuff, it's really common to do some extra rotation, inter-rotation stuff with baseball. Position players and pitchers alike, we've all been doing that to warm up, get those muscles activated and strengthened. It's not really going to be a common part of the regimen on a normal day-to-day, but it has been in the recent years. So bands, again, really popular. This is one, banded pull-aparts. Just some goals for people or some cues to start off. You want to have your elbows close to the side, and you're just pulling it apart. Basically external rotation, but it's a one continuous band, so you're getting both involved at the same time. We don't really want to press too far in range of motion, and I'll just pass it around. You guys can keep going as I'm talking. It's really important to be mindful of who your patient is, how significant their injury is, how it happened, and what their goals are during the rehabilitation process. We had a patient recently who suffered a really bad AC joint separation while he was playing tennis. He charged the net to return a shot, and then upon returning it was like, I'm going to hit the post with my face. So he turns his head, and the post just goes straight into his shoulder, and it was the worst AC joint separation that I've seen. And so his goals, yes, obviously at one point, there are at certain points they will be focused around range of motion, but in the early stages where we're in this like mass protection phase, his focus was on no pain whatsoever. So you give somebody a basic exercise like the banded pull apart, which seems really easy, and he really wants to push it, but if he keeps pushing it, he feels pain. So it's tough. You have to be able to reel people in, even on basic exercises like this, where there's really no explaining to do. It's not that difficult. We need to be mindful of who the patient is, how it happened, what their rehab goals are. And then once they progress, you can show them certain progressions, like how close to the center of the band. You can fold the band over, that increases the resistance a lot. Holding it further apart obviously makes it easier. And then at pretty much every PT clinic that you will go to, there will be color-coded TheraBands and performance bands, like ones that use for lateral blocks. And the color-coded is significant to the level of tension that each band has. And then again, the progressions stay the same, folding the band over, holding it closer to the center. And then again, just being mindful of the progressions as you go through, and increasing, you can add a resistance or a pause rather. So you can do a set of 5 with a 5-second hold when they get out to their desired range, and they bring it back in, relax a little bit, bring it back out for 5 seconds. So yeah, and then some common mistakes that you will see of people doing this. is they'll let their elbows fly off their body and they get a lot more of their arms involved, and that's not really the goal there either. Or they'll come up if the resistance is too strong, they'll start compensating with kind of raising it, and then they're almost getting that trap involvement as they pull out, or like a little bit of lats, and that's really what you want to avoid. If you see that, it's just a sign for you to reduce resistance.
All right, we're good. Let's switch sides.
That's really what I got for you guys. Banded pull-aparts, they're not that exciting, but there's actually a certain level of importance to the analysis that you're going to have to be doing with the patients, making sure that it's not too heavy, that they're staying within their rehabilitation goals, things of that nature. So it's just kind of interesting. Take a really simple exercise, kind of boring, honestly, but there are important things to be aware of while you're running somebody through this.
Is it, could it be front or back?
Yeah, so it's about 80%, I would say, are supraspinatus, and then it's a certain muscle. So supraspinatus is like one muscle, and then I'd say like 20% are infraspinatus. But yeah, it depends on, depending on what muscle you tear, the surgery is pretty different, the rehab will be true. So I'm like, so undergrad, so I don't have specifics. Depending on what muscles are involved in the tear, the rehab program will adjust accordingly.
So the supraspinatus is on the back.
So it's pretty neutral, yeah. So I guess it's like
Tommy, Tommy. All right, how are those exercises? Are they good? They're hard? That's good. All right, so we're gonna have Crystal, Brody, and Henry pick a person to demonstrate, and myself, and what we want this time is the demonstrator to do the exercise, but then you guys as the class tell them what they're doing right or what they need to fix. Does that make sense? Yeah. Okay, so Crystal, if you can pick someone from your group, that was
Vince.
Vince? All right, what is Vince doing? So Vince will do it a couple times, and then you guys can kind of like shout out what you think he's doing well, or you guys can raise your hand, it doesn't matter, but we want people to point out what he's doing right and what he needs to work on. So go ahead, Vince.
He's doing a good job at keeping his spine alive.
Where should you feel the stretch? I think like some people had difficulty feeling the stretch because their arm wasn't close enough to the body, and when they were pulling the stick, they would pull it out that way instead of just keeping it straight. Yeah. Okay, good job.
Ready? All right, I'll have Augie come do the. Let's go. So while Augie's doing this, just try to mention what he's doing well, what you see, what's important.
Try to remember those cues that Brody was saying for this external, internal rotation. You guys can point it out, give a shout what he's doing right or what he needs to work on.
What are you trying to do with the elbow? Keep it close to your body. Exactly, yep. Make sure not rotating too far, a good 90 degrees. Sure.
Anything else? Anyone? It's got good pace, not going too quick, and so keeping that tempo. Important to work those muscles and not going fast pace.
It's good. Thanks, Augie.
All right, I'm gonna have Brett demo band pull right here. All right, so as you can see, he's keeping his elbows close to his body, which is important with this one. I talked about with a couple of groups how when the resistance gets too heavy for some people, it's going to come off their body, and they might try and like incorporate their traps and like lift it up a little bit more, and that'd be like an indicator for you to like lower the resistance for them. And he's going at a good pace again, as it's being mentioned. If it's feeling too easy, he could like hold it closer. But yeah, this is a pretty basic one, and this is important to be mindful of like who your patient is, and like how significant their injury was, what their goals are for the rehab. Yeah. Thanks, Brad.
I want Noah to demonstrate the wall sits. I don't want to do that. Again, if you guys see anything that he's doing right, just remembering those cues I mentioned. Call him out, what he needs to work on or things he needs improvement on. Go ahead. Anyone? I can tell him that, and he improved it. So Leo said that his back was a little bit off. Good. Anyone? Maddie, Vince, anything that he's doing well? Good tempo. Good tempo? Yeah. All right. Thank you all.
All right, guys, so we can bring it back up over here really quick. We're going to get ready to go into the second milestone. Yazi is going to be taking a group. We're going to go back to that 3-group split that we've been doing in previous classes. Yazi's going to be taking people and showing you guys like the pendulums or the shoulder swings. I'm going to be taking some people over there in the corner, and we're going to be doing like some resisted wall climb. And then Brody is going to have people doing spider walks. So are you going to be over there? Yeah. All right, so Yazi will just go in the middle, Brody will be on that wall, and I'll be over here. And we can just go 3rd over there, 3rd down the middle, and then a 3rd in that back corner. So wherever you're closest, we can head over there. Let's do it. Bringing it back. All right, so we're gonna have to slide down to a wall so we don't just mess up these mirrors super bad. But what we're gonna do, this is common. The goal today was we had to do it on a table slide, but can't really bring a treatment table into the dance room. So this is just gonna be like a resisted wall slide. And this is a pretty heavy dance. This is gonna be a little bit of a jump in the rehab program. You're not gonna be doing this very early on. This is gonna be more middle of the road, almost towards the end, but not quite yet. So what you're gonna do is you're gonna have people close to the wall like this, and the goal is to have the band at about shoulder width apart, and then you're gonna be just holding that and sliding it up. You're gonna keep that resistance. It's hard, it's not easy. Progression here, holding it at the top for a long duration of time. Like you can do like, again, 2-3 second holds. Having like a 10-second hold up here is pretty tough, as throughout the exercise, you're gonna be holding holding the band out. You're trying to resist it. You don't want to let your hands like collapse in and feel that resistance kind of fade away. That's what you're going to see commonly with people here. So again, you just want to like hold that resistance out and glide up the wall and then bring it back down. So yeah, you guys can come up and just do a couple of reps each and then just kind of pass it along. It's pretty tough, but yeah, it's similar to the same muscles that are involved when you're doing like external rotation on a band or at the band pull aparts. We're not just holding those throughout. So it's more of just like an endurance training. It's going to be a little bit tougher. Yeah, it's insane. It's tough. They didn't have a weak band in the training room, so this is a little bit tougher. Yeah, definitely not the easiest thing ever. But the goal for you guys is just do a couple reps. Dude, it's tough. It's a tough band. This is like legit. Oh, is this easier? Try that. Try that one. Try that guy out.
Yeah.
Thank you, Crystal. Yeah, real nice. Yeah, this is one that patients pretty commonly complain about. They're like, "Oh, this is hard." I'm like, "Yeah, duh, dude. It can't be. Everything you do can't be easy. Otherwise, you're not really gonna Yeah, try the black one out.
So are we walking the arms?
Yeah, it's like
walking them up, or we just
it's a glide. So another like variant of this would be a table slide, where it's just an isolation and you're just kind of reaching your arm straight out. So we're trying to just mimic that movement, but with some band resistance on a wall. So it's just a glide, and then you bring it back down, and then glide.
It's a freezing.
Just bodies it.
Monster.
That rock muscle, baby.
Dude, like I said, no one's gonna be able to resist no one doing.
There will not be band strong enough for Noah at traditional clinics.
Even like 2 days post-op.
Yeah, it's
2 days
post-op.
yeah, fresh on the operating room. We're dominating this. Yeah. No, but
on the
again,
table unconscious.
yeah, similar themes to other ones is you want to make sure that the resistance isn't too heavy, and you're going to see like shoulders collapse, or they're going to give up on it as they're kind of going up throughout the wall. So you're like, they'll start strong, and as they're kind of going up and it gets harder, you'll see them like kind of lose it, and then they'll rest at the top. And then like you don't want to see the in and out on the resistance. It wants to be kind of consistent. Noah was a really good example. Obviously, just dominating that, keeping it in the same spot, wall slide and back down. Yeah.
Nice. So do you want the elbows to stay directly under the hands? You don't want them?
Yeah, that's another thing too. It's like, that'll be indicative of like too much resistance. If the elbows will slide out, and it's like a compensation.
Yeah.
So I thought you did a good job at like just keeping those elbows there, and it's really just focusing on the slide. Because the table slide is, I guess, a little bit easier than this because you're not gonna be able to incorporate a band there, and it's really just your arm is just sliding down, and then right back. Gotcha. And then just sliding right back out.
On a table slide, are you literally standing next to a table?
Commonly sitting, so usually like on a treatment table, and then they just slide it out, and then slide it right back. And then you can also incorporate that with like a physio ball. So they'll have their hand on a physio ball, which is really high. None. So that's earlier along in the progression. So that's our strength and conditioning class. Yeah.
Tommy.
This is definitely more intense.
Tommy.
Like just
Go ahead and rotate so guys can do this over here.
Alright guys.
Alright, so disclaimer, I only have 4 of these. I couldn't find people there's how many? 5 of us. So one of them is just going to be doing just like free weight. So what we're going to be doing is called shoulder swings. And what we're going to do is we're going to have a little slight arch bending forward, and we're going to retract these scapulas, because if you don't retract the scapulas back, then we're going to be arching. That's not what we want. So we don't want to retract. We want to retract the shoulders so we keep it locked. And what we're going to be doing is kind of letting that med ball take us. It's going to be doing that.
Resistance, and you want to keep your arms at about the same.
And what we won't want to get is that arch, and we want to keep that core tight, and you can turn back strong here. If you want to give it a try.
Approach the wall, and so you want to hold this resistance, and then you just slide.
Good, so if you guys gonna line up across the wall.
And then back down.
Some space.
Alright, so let's give it a try.
That's got enough.
There you go. So keeping this left hand on your hip.
Too heavy? Is there gonna
Again, we don't want to see us slowing down, so we want to keep that chest up really high, facing forward.
and then bring it back
A little
out.
slight bend on the knees, slowly go down, let the weight just take your shoulder with you. And this is important because, again, we want to get that range of motion and articulation in the shoulders, because a lot of shoulder movements is just, movements up here and down, so we want to do that.
Those muscles and holding those movements. So you guys can come up.
And if you want, give it a switch.
Either arm or just the other way.
Just have it around your wrist and about similar sort of.
Yeah, you can do different directions, just kind of play with
And
it.
approach the wall, just kind of put your forearms.
Does anyone have any questions?
And then
Why we do this?
slide it up. And then hold the band there.
Anything? Any questions?
Again, as they get better at this and their muscles get stronger and just progressing throughout their program.
It's just to get a range of motion. How far along is this? This is like, so we're still doing the 1 to 4 weeks, but this is like towards the end of that. So this is like not dangerous at all.
Yeah.
This is just kind of letting the like shoulder move around, getting you guys back in there, making sure that scarring doesn't build up in there.
There's really no resistance, and they're commonly sitting at the table and just sliding.
How long is the recovery?
You can also incorporate the physio and it's really basic movement.
So a fun exercise I want to try with you guys is with the shoulder swing. So you can put that med ball down if you want, but so we're gonna be So just picture you going inside with your right hand. So the right hand's gonna be going inside like this, and then try with your left hand to go the opposite way. So if our right hand's going inside, our left hand is going out. We'll try to do that at the same time. So right hand is going inside, and our left hand is going outside. Hands going the same way to try to like, isn't it? So
No, they end up going the same
that's
way.
going out. So
Feel that stretch across, it smells like a nervy stretch.
this one's coming out.
Yeah. But if you do them at the same, like this is, they're going the same.
Or do it with your fingers out
Outside.
so like this, and this one coming forward or away from you, and another one coming towards you. And keep your hands straight so you don't make shoulders.
Oh my.
But can you keep your hands straight when you do it? You have to come in and out. You can't even do it.
Well,
You can't ask
I had to
us
say
to
I was
do it.
perfect.
You can't even do it.
Shut up, try. Yeah, that's another one where you do. Yeah, those are the shoulder swings. Does anyone have any questions again? Any questions?
Great, so we're gonna move to Tommy?
John!
Tommy? John! Nice movement, I see you guys wanna go ahead and rotate away from this group. Now we got this group over here. So tricky.
Over here, that's not good.
All right, so for this little milestone, we're just gonna be working on a lot of range of motion things. So for the first exercise, we're gonna be facing the wall. we're going to start with our shoulder at about, or arm at shoulder height. And then we're going to act like our fingers or spider. We're going to walk all the way up, feeling that stretch of that back lat, and then bringing it down nice and slowly, making sure that we don't start to walk our spider outwards this way, or over here. Just making sure we go straight up, feel that nice stretch down the back, slowly back down. Make sure it is facing the wall. So if you guys want to get a little space against the wall, if you don't have any questions, you go ahead, give it a try. Again, making sure it's nice and slow and controlled on the way up. Feeling that nice stretch once you get to the top. And then come back down nice and slow. Awesome, everyone's looking good. It's quite the reach there, King. So you can try it if you want. So you guys just feel a little stretch to the back there. Just slide it in. And just do a side to the bows. Back down, and you guys can come out here and try it. Yeah, we're jump right on the black dance and feeling ready to go. Not so much, so we don't want to be all again. Yeah, because first positions our arms are staying parallel, similar to the positioning we would be beginning with when you pull apart the last position.
What's that?
0 into
Stretch it.
Next minute. No, once you guys just finish, you can just do it on the injured arm, and then we'll bring it back up and do another exercise. Alright, so you guys are going to bring it back over here. I'm going to show you how to this wall again. Alright, so for our second one, it's kind of called the clock. It's like a neural flossing kind of thing for our labrum. So we're going to stand here with the arms straight back, making sure we're facing forward. Our hips aren't turned to the side, but everything's straight. And we're just going to take here, palm planted, and just bring our fingertips back. 3, and then going at an angle here. 3, and then once you do that, all the way up. Pulling down for 3. Once you get higher and higher on the wall, you sort of feel that stretch more and more. So again, important things here, make sure we stay forward the whole time. People tend to start to come here once it gets tough. Making sure we're really staying stretched out, pulling back 3, 3 here, then 3 up here. We'll do 3 sets of 3, if that makes sense. Alright, so if you guys want to try, go ahead. You should feel that nice nervy stretch. Pretty for this one. Yep, and if you want to turn your head to the left, you can get more of that nervy stretch through that arm and neck. Yeah, sometimes you can feel all of your
That's nice.
Yeah, this is a good one you can do if you don't live there. Feels good. I'm just trying to get this one. Go ahead and just finish up your 3 of those. Everyone's looking good. Sweet. So you guys finish up and just bring it back forward here. Get ready to rotate. Bring it back to the center. What's up?
Yeah, that's the spot.
All right, Tommy. Tommy. All right, if you guys want to bring it back up to the center again.
Just like actually pulling your muscle. Oh, that's so bad.
Alright, so today we started class with some shoulder stretches, and then we divided the class into 2 parts. So the first phase we focused on isometric and range of motion exercises, and then the second portion we focused on restoring mobility. And for next class, we're going to work on phase 3 and 4, which is strengthening your shoulder and then getting back into your sport. So yeah, thank you guys.
Alright, yeah, so I just want to do a little cognitive, and you guys can sit down if you want to get some relax. Maybe I'm tired from the dancing or whatever. So, just a couple quick questions. How do you guys feel about your first PT experience with shoulder?
Great.
Yeah? What was tough about it? Anyone?
The wall slide.
The wall slides? Why?
Well, the shoulder messed up,
Oh.
and then I'm just not very mobile.
Anyone else? What was easy? Anything easy about it? Was it all hard? Yeah. All right, another question. How would you guys feel being in a sling for a month? With not doing really doing much? Anyone? Why? Vince, why you said that?
Just, I mean, not moving your shoulder, you know, you're having sympathy and those muscles rushing your rotator cuff, and then your arm gets stiff because scar tissue builds up, it's not fun,
Yeah.
you're scared.
So that's why it's super important that we do the exercise like how we do the shoulder swings, so we don't want that scar tissue to build up. How would you guys feel having like your roommate or your significant other help you change? Because you know when you're in that sling, it's super hard to get that shirt back. Would you guys be comfortable with that? Would you guys be like, how would you guys feel about that? Having someone like dress you? Spencer, how would you feel? Because I know you have a girlfriend. So
I had a shoulder injury last year and it sucked.
yeah.
It took me forever to do anything.
All right. Well, thank you guys.